How far can a school go to address the behavioral problems in children with developmental and psychiatric disorders? Could shocking students be an effective treatment, or is it just torture? Massachusetts state officials have been trying to ban a practice known as graduated electronic decelerator skin shocks, GED for short, at the Judge Rotenberg Center. It's a school and residential facility, and this has been sort of going on since 2013, but a judge recently ruled that this treatment for students with special needs is acceptable. And this is a controversial practice, also a controversial ruling. Now joining us to discuss via Skype is the Director of Medical Services at the Judge Rotenberg Center, Dr. Nathan Blinkish. Also joining us in our audience, the Co-Director of the Child and Adolescent Psychiatric Emergency Unit at Harbor UCLA, Dr. Patrick Kelly. Thank you both so much for joining us. Dr. Blinkish, I'd love to start with you. Tell us a little bit more about how you use this shock treatment and also why you use it at the center.
Skin shock is used as a consequence for treatment refractory problem behaviors that have been exhibited by individuals that have not responded to traditional treatments like medications or typical behavioral procedures. We use it as a part of a comprehensive behavioral program. And each individual has to receive individual court approval based upon a treatment plan that was composed by one of our treatment staff and approved by a Human Rights Committee and a peer review committee, and as well as the guardian has to consent. And the reason we use this treatment is because it is so effective and life-changing for some of the types of behaviors that we treat, such as someone striking themselves in the head 2,000 times a day, blinding themselves, gouging their eyes out, pulling their teeth out. These are the kinds of topographies and behaviors that we treat with GED at JRC.
How does this actual treatment take place?
So what happens is the clinician selects specific behaviors that are going to be targeted with the GED. And then those behaviors are listed on a recording sheet. If the student emits one of those topographies, then the staff are trained to activate the device, which delivers a 2-second skin shock to the surface of the skin. And it's on and off and it's over with. And that is the typical procedure that happens with the GED.
I mean, have you had this done on yourself? How would you describe this particular shock? I mean, how?
I've had hundreds of GEDs I've had applied to myself. And it's uncomfortable. It lasts 2 seconds, as I said. But again, we have to compare it to the other treatments. Most of the people that we're treating are being treated with massive doses of antipsychotics, many other drugs that haven't been effective, and they are typically restrained. And here's the other thing. Most programs won't accept them and are not willing to treat them. Many of them are in psychiatric hospitals for a year or longer before they're sent to our program. So you have to compare it in context with the treatments that they're used to getting.
And in your mind, it's effective, it works.
Yes, it is a very effective treatment. It is life-changing. I mean, you can imagine a lot of the students we see are sedated, they're restrained, they haven't been home in 5 or 10 years, they've hurt their family members, they have active and open sores on their body. Once we treat them effectively with GED, all those things change for the better. It really can be a dramatic result.